There's a rise in cases of conjunctivitis or Madras eye across Tamil Nadu, around 4,500 cases every day, says the health department. And since the onset of monsoon, more than a lakh people have been treated, 1.5 lakh people. Joining us now, Dr. Ashwin Agarwal, the director of Dr. Agarwal High Hospital. Doctor, thank you very much for your time. Is this unusually high?
Thank you very much for having me. I definitely think that this is definitely high compared to the previous years. There is definitely a rise in conjunctivitis, and the simple reason for this is the seasonal variation. The reason probably is also that people are mingling more and talking to each other more, and that is also because of the handshakes, the number of times you're touching surfaces.
Symptoms for Madras eye and how does it spread?
Madras eye has very few symptoms, but they're very alarming symptoms. They're redness, watering, discharge, maybe purulent, that means it could be yellow or green or white in color, and pain around the eyes. And this could increase if the corneal involvement is there with blurriness of vision and pain which exuberates more than normal.
Treatment, and should one isolate?
So I think isolation is not recommended. At the same point, too much public appearances is also not recommended. So what I would say is do not self-treat is the first condition over here. The reason why I say do not self-treat is because you do not want to be treating a condition you don't understand. There are a lot of conditions that this condition can mimic. For example, acute conjunctive glaucoma. You can have chronic corneal ulcers and other conditions which can mimic a conjunctivitis. So please do not try and treat at home. Just immediately as soon as you see any redness, watering, discharge and pain, go to an ophthalmologist close by, very close, and start the treatment as per recommended. Sometimes people even self-treat with steroids, which is a complete no-no in these conditions.
How does it spread, doctor?
So the common myth is that the spread can happen by looking at you. This is a very common myth, but it does not spread in that format. It does not spread with aerosols. It spreads directly by the secretions of the eye. When a person touches the eye and touches a surface or handshakes somebody or it's on the bed linen or any surface that it touches, the secretion touches, and the next person comes and touches that. That's how it starts to spread. So few of this very easy way to prevent this, whether you have it or you don't. During this monsoon time, it's very important that you clean your hands and face at least 8 to 10 times a day.
Doctor, thank you very much for your time. That was Dr. Ashwin Agarwal talking to us. The Tamil Nadu government says it's raising awareness across the state, and there are more than 40 government eye hospitals to treat patients with symptoms or who have got the infection. In Chennai with Suresh, Sam Daniel, Find It TV.